The lateral aspect of the leg, there are two muscles. One called fibularis longus, and another which is called fibularis brevis. Fibularis longus starts at the proximal end of the fibula, becomes tendinous, here's its long tendon, goes behind the lateral malleolus, and then enters into the foot. This particular muscle goes underneath the foot and comes out on the medial side. So this muscle helps to maintain the arch in the foot, and it goes to the exact same spot that tibialis anterior inserts, the first metatarsal and the medial cuneiform. So fibularis longus is here. On either side, at the distal end, is fibularis brevis. In this model here, it looks as if they're fused together, because they're fused here because it's plastic, but in real life, these are two separate muscles. Fibularis longus at the proximal end, fibularis brevis on either side of the tendon at the distal end. Both of them go behind the lateral malleolus to enter into the foot. The posterior compartment of the leg has two main compartments. It has a superficial compartment that makes up our calf, and it consists of three muscles. Gastrocnemius, which has two heads, a medial head and a lateral head, which start up on the femur, merge together distally, and attach to the calcaneus via the Achilles tendon, also known as the calcaneal tendon. Deep to gastrocnemius, you can see soleus. Soleus is another calf muscle. It doesn't start on the femur, but instead starts on the tibia and fibula. Its muscle belly, you can see from an undersurface, it looks like a fish. So soleus is coming from the term sole, which are flat fish that you find at the bottom of the ocean. So these two fibers, or these fibers again of soleus, they all merge together and attach to the calcaneus by the Achilles tendon. The last muscle in the superficial compartment is plantaris. And plantaris is this really thin tendon in between gastrocnemius and soleus. Here's the muscle belly proximally. Some people don't have this small little muscle, and as you can tell in comparison to gastrocnemius and soleus, it doesn't have much of a function in comparison to these two large calf muscles. In the deep compartment of the leg, we have four muscles, just like we do in the anterior compartment of the leg. These muscles, or three of them, will cross behind the medial malleolus to enter into the foot. There's one muscle that doesn't cross the ankle joint, and that is popliteus. This muscle here runs on an angle, and it's involved in unlocking your knee. In this particular model, it looks quite large, but in real life it's not. I don't think it's this long. The other three muscles in the posterior leg, deep posterior leg, we can go down to the medial malleolus and look to see how they actually cross in order. So there's three. We have Tom, Dick, and Harry. Tom, Dick, Harry. So if we start with Harry, if we follow this tendon proximally, this is hallucis. Harry stands for hallucis. This is flexor hallucis longus. It starts on the lateral aspect of the leg. Once it gets into the foot, its tendon goes medial to attach all the way down to the distal phalanx of the big toe. If we go back to the tendons here, if this is Harry, this one is Dick, digitorum, flexor digitorum longus. Okay, so flexor digitorum longus starts medially. Once it enters into the foot, it goes to the lateral digits. The last one here is a small little tendon, which is tibialis posterior. Tibialis posterior actually goes deep to the other two and then comes out at the top here. Okay, so tibialis posterior, you can kind of remember it represents Tom at the medial malleolus. You can say it's the peeping Tom. It peeps out in between hallucis longus and digitorum longus. These are the muscles in the deep compartment of the leg.